This demonstration is to show how to give an intramuscular injection using the Z-Track method. The first thing that you want to do when administering any medication is follow the 6 rights. So you want to make sure that you have the right patient, the right medication, the right dose of that medication, the right route of administration, it's the right time to give the medication, and also that you do the right documentation as soon as you're finished. So for this particular medication that the doctor has ordered, we would look at the order and check the mark. In this particular case, the doctor has ordered a medication that needs to be reconstituted. So we perform hand hygiene, and then you find your vial of powder that needs to be reconstituted, the diluent, which is what you will add to the vial of powder, and then we need a syringe and a needle. So for reconstituting medication, you have to look at the ordered dose and the ordered concentration, and then check on the medication vial or the insert in the box of medication to know how much you need to use of your diluent to reconstitute to the strength that the doctor has ordered. So for this case, we are going to add 10 milliliters of diluent. So I'm going to wipe off the top of my first vial. I'm going to wipe off the top of the diluent. So I will add into my syringe 10 milliliters of air. I'm going to stick my needle into the diluent, putting in the air, and then flip the vial over 90 degrees and draw up 10 milliliters. Okay, once I've done that, I'll make sure that I tap it and get those pesky air bubbles out of there. All right, so now I have, there we go, 10 milliliters of my diluent, and I've already wiped off the top of the second vial, so I'm just going to insert the needle, put in the 10 milliliters. Okay. And then this is going in the Sharps container. I don't need it anymore. Okay. Once you have your diluent added, you're going to gently mix the vial between your hands. Okay. And it is mixed. I'm going to check the vial, make sure that it's all the way mixed. Looks good. So for this intramuscular injection that I'm going to give, I have a 3 milliliter syringe and a 1.5 inch long 22 gauge needle. And the doctor has ordered this medication to be administered in the ventral gluteal site. So I am going to draw up, it's 1.5 milliliters that the doctor has ordered for this patient. So I draw air into my syringe. And I'm going to put that air into the vial and then draw back 1.5 milliliters. Okay, there's no air bubbles in this one. Okay. Then I am going to recap my needle using this one-handed scoop technique. Whoops, I grabbed the wrong cap. Scoop it with this special safety cap. There we go. And click that on. And this way, it's safe to walk to the patient's room with the drawn up dose. So, and I've double checked I have the right dose, the right medication. Now I'm going into the patient's room. Good afternoon, Mrs. Hen. I have orders from the doctor to give you medication F today. I'm going to perform hand hygiene and put on a pair of gloves. Would you please state your name and date of birth for me? This is done to ensure that we have the right patient. Okay. And I would explain to Mrs. Hen the reason for her injection and answer any questions she may have about the medication or the procedure. So for the ventral gluteal IM injection, you would have the patient either standing or lying on their side in the bed. And that enables you to find the site easily. So to find the ventral gluteal site, you're going to put your hand, the palm of your hand, on the greater trochanter of the hip. And then you're going to put your index finger on the anterior surface of the spine and point your middle finger at the iliac crest. And this spot right between the V, that is going to be your injection site. Okay? The other place that you could give this injection is called the vastus lateralis, and that is a large muscle between the hip and the knee on the anterior and lateral side of the leg. So to find that spot, you would have the patient either laying supine or sitting in their bed, and you would go a hand's breadth in from the greater trochanter and a hand's breadth in from the knee, and you're making a rectangle on the leg, on the side of the leg, and that's your injection site. So once we've found, we have our patient lying on her side, and I found the injection site of the ventral gluteal area, I'm going to take a alcohol prep pad and clean the injection site, starting at the middle and going around to the outside. Okay. And then for this particular, can you see that? Okay. For this injection, we're going to, for the Z-Track method, you take your hand, the non-dominant hand, pull the skin off to the side. I don't know if you can see that. Okay, there we go. Pull it to the side, and then using a 90-degree angle, I'm going to inject. Okay, then we're going to stabilize with the non-dominant hand, the syringe, and just aspirate to make sure we do not get any blood. Okay, there's no blood return. That means it's safe to continue the injection. So slowly, over 5 to 10 seconds, I'm going to administer the medication. Okay? And then pull the needle out the same angle I went in, swiftly and smoothly. And then I would take a gauze pad and I release the skin as soon as I pull the needle out, and that seals over the injection site. Now, if there is any bleeding, you would just dab with a gauze pad. I want to go back and touch on if you aspirate and there is a little bit of blood, you're going to want to make sure that you immediately remove your needle and you start completely over again, because that blood that you aspirated is going to compromise your whole injection. Okay, so once the procedure is done, we'll return the patient to a position of comfort. Take off the gloves. Of course, she could get a Band-Aid or a light dressing if she was having a little bit of bleeding from the injection, but in this case, she was fine. And as always, immediately we're going to document the drug, dose, and injection site in the MAR and also in the nurse's notes. I hope you've enjoyed this intramuscular Z-Track injection demonstration.